All right, I have a video that's not quite about fertility, but I have mentioned it once before. I have degenerative disc disease. It comes from my dad's side. My dad has it, and there's too many relatives to name on his side that have it. Plus, my little sisters both have it. To add to the fact, my mom actually got injured and has the same issue, but hers isn't genetic. Anyway, I'm so sick and tired of being embarrassed about it. It's not something that I can help. It's not something that I picked or chose to have. I can't choose when I have a flare-up. I can't choose how the flare-up is going to affect me. Like, for example, I'm off work today because yesterday when I got home, I thought, oh, it's a beautiful day. I can go and pull some ivy off the side of my house. Not thinking you're going to be tugging. You're going to be pulling some of the ivy. Well, all that ivy's grounded in the ground. You're going to be pulling at it. You're not normal. You can't do things normal. You may feel good today, but remember, you've got multiple discs shifted and poked out in different positions. You've had 2 back surgeries. Yeah, you're 34, but you're not normal. So I go out there and I'm pulling and tugging and I'm having a good time because, you know, I'm working on my home. And for a split second, I felt something, but, you know, with disc disease and with having discs that are always protruding one way or another, sometimes you feel things. You just keep going. Well, then, I'm fine. I get, you know, into the house. I take a shower. I do my things. I finish what I need to. I go to bed. About 1 in the morning, I get up to go to the bathroom. I get back in bed, and just the motion of stretching out in the bed, I shifted the disc that earlier I had irritated. That set off leg cramps all night long from the thigh down to the ankle. I didn't really sleep. And I knew in my mind that you need to take this day off because if you don't and you push it, then I could end up off of work for a week or more. Or possibly in surgery. I've done it. I've pushed it. I've ended up in surgery. I still got up at 4:30 in the morning. I still got dressed. I still drove down the street. My sister works with me, and she goes a different way, and some days she goes in early like when I do. So I was going to follow her to work. She was going to show me her route. We went to stop to get, well, she was getting breakfast, and I knew I can't do it. I had to text my manager. I was so embarrassed I wanted to lie. I wanted to badly, like, it's so embarrassing. It shouldn't be embarrassing. But people, because I look normal, and because until I'm in a flare-up, I don't look like I have an issue. People don't understand. They think I'm lying. When I hang that handicap placard up, they look at me like, you know, 34 years old, and it looks like there's nothing wrong, and look at her. I mean, if you really stared and looked, you could see that I'm crooked. Like, it's, when I'm in a flare-up, you can clearly see that I'm standing crooked, but when I'm not, it's so slight, you don't know. You don't realize that I'm internally broken. And there's nothing I can do. So I send the text to my manager. And all I can think is, what if this doesn't, like, heal tonight? What if, like, I have to send it tomorrow and the next day? Because, like I said, it looks like I'm playing hooky. You don't know. You don't realize it. When I have to wear a back brace, I wear one of those stretchy, like, elastic ones. Actually, I think it's a belly binder for people who've had surgery on their stomachs. And I wrap it around and I pull it under my clothes because I want to hide it because I'm embarrassed. This is something I've had for the rest of my life. Like, I can't get rid of it, you know? It's embarrassing. And then on bad flare-ups, my husband has to help me do everything. Everything. Shower, bathroom, get into bed, get it dressed. I mean, everything. Thankfully, so far, I've been able to go to the bathroom on my own. I'm going to have to shower tonight. I might have to get him to help me from the waist down because it's mainly, I do have issues in the top of my spine, but it's mainly my lower back. I'm just tired of being embarrassed, and I'm tired of complaining, and I'm tired of looking normal, and then one day I'm missing like 1 to 2 to 3 days of work, if not more. When I put in intermittent FMLA, which is basically like an insurance policy, you have it set up through work, so if something does happen, there's an allotted amount of time that you can take that FMLA will cover your job. My management didn't understand and freaked out. I had to explain to them the first time what it was. And then with my company, and I don't know if it's like an Ohio law or what, but every 6 months you have to renew. So the renewal is coming up this month. I went to renew. Of course, the medical place notifies my management, and they freaked out again. I don't mind explaining. I'm an open book about it, but I'm going to have it all my life. And I've been dealing with like chronic part of it. My first surgery was 25. I started having issues at 13. I lifted my baby sister up and slipped a disc. You shouldn't slip a disc at that young, especially when you're not picking more than like 15 pounds up. Then they kept telling me it's a pull muscle, it's a pull muscle. And they kept pushing me off. And at 25, I got married and we moved and I slipped the disc and broke it off in 4 pieces. And I had emergency surgery. They didn't know how I wasn't paralyzed. Then in 2012, I slipped a disc again. It was 75% out. I was basically paralyzed in bed for 3 months. I could still move, but the pain was so bad that my husband did everything. Everything you can imagine. Just imagine being paralyzed, not being able to do anything for yourself. My husband did it. And we lived at my grandparents' because at the time we lived in a 3rd floor apartment and couldn't get into it. The ambulance had to come get me out of my apartment. My elderly neighbors saw them come get me and thought I had died because I didn't come back for 3 months. I've been in wheelchairs, I've had surgeries, I've had steroid epidural injections, I, see the chiropractor, I see the specialist, and yet, most of the time I look normal. I'm just tired of being embarrassed. And then, when I tell people I'm doing fertility, they go, "Can I ask you a question? Is that okay?" And I'm an open book, I don't care. But it never fails. They go, "What about your back? Have you ever thought about that?" Well, let me tell you something, lady. I, for about 2 years, decided I didn't want to have kids because of my back. But then I got together with my back specialist, explained what was going on, asked if it was dangerous. I know what it could do. I've had multiple conversations with my doctors. They know, they're on board, but it never fails. I get asked that question. Like I said, I'm an open book, but, All right, I'm sorry for the long video. I wish I knew how to edit or had software to edit, but at this point, I just know how to click record on YouTube. So I figured I'd get my frustrations out because everybody in my personal life is kind of tired of me doing this. But yeah, so living with a chronic illness is not fun and it's embarrassing. One day I'll accept it and maybe not care what other people think. But today I'm super embarrassed that I even had to call off and might potentially have to tomorrow too. So, and here I sit. Thankfully, this flare-up is letting me sit, but you should see me walking. And going to the bathroom or bending, I have to be super careful. All right. Well, I hope you're having a better week than me. Still no period. But polycystic, I'm just waiting on a fertility clinic to call me on that one and ask for blood. Anyway. Have a good rest of your day. Bye.